A lot of people discount how to evaluate the fluid status of a pediatric. In fact, a lot of people just discount evaluating anything about pediatrics. They're like, yeah, pediatrics, they have a high heart rate and they compensate till they don't. And I'm just going to transport this kid, hope they don't explode, not do a whole lot, not assess a whole lot because pediatrics. There is a lot that we can do to evaluate the fluid status of a pediatric patient. Heart rate is one of them, but the heart rate could indicate their fluid status. It could indicate their ventilatory status. It could indicate their oxygen status. Kids are a one-trick pony. Something goes wrong and their heart rate increases. So we also want to look at their blood pressure. We're taught in paramedic school to discount pediatric blood pressures because of the whole they compensate until they don't. But they do become hypotensive. You know, you can only compensate so much depending on their status. You know, we get these kids that haven't been feeding very well or eating very well or drinking very well, and their base excess is like 20, and their heart rate is like 160, 170, and, you know, they might be 6, 7 years old, and their blood pressure is like, you know, 60 over 40. It happens. Kids become hypotensive, and we are really, really obnoxious about saying that their blood pressures don't matter. You need to monitor blood pressures on all of your pediatric patients. And then you need to evaluate their skin tone. Are they kind of that sick, not sick look when you walk in? Are they nice and pink? Are they too pink? Are they flushed? Are they blue? Are they ashen, like gray? And then you want to see how dry their skin is. Look at their mucous membranes. You want to look at their capillary refill. Squeeze their finger, and not just a small squeeze. Like, squeeze that finger for about 2 to 3 seconds and then evaluate the blood return. We want that to be less than 3 seconds. But also keep in mind that like little kids, like infants and toddlers, little toddlers, a lot of times their fingertips will perfuse fairly well. But you'll look at their hands and their palms and their feet, and they might look a little bit more white. So rather than doing the fingertips on these really little kids, like, use the whole hand or the whole bottom of the feet, and that will give you a much better idea of their true cap refill. And then obviously their skin temperature as well. If their skin is really cool, then they're probably not perfusing very well. They may be volume depleted. And if they're really warm, they may not be perfusing very well. They may be vasodilated. So there's a lot of different tools that we have in our toolkit to evaluate the fluid status of pediatrics.